Let's check the last part of this unit, that is Unit 8, Patient Discharge. And in this case, we're going to be talking about making appointments on the phone. Okay, in this case, sometimes in some hospitals, nurses are in charge of doing the appointments on the phone. It is not the receptionist, but the nurse. So I want you to observe this chart. In this chart, we can see what is the checklist for making appointments. What are those elements, the key elements that you need to consider when making an appointment? For example, first of all, you need to greet the person. You need to identify yourself and the department or unit, or even the name of the hospital. You need to you will receive the reasons for the call. You will suggest the day and the time, confirm the day and the time, give patients details of whatever is needed, the day, the time, maybe if they need to bring something with them during the appointment. And finally, you need to thank the person to finish the call. So here we have an example of the different elements in this recording. So please check the recording in the presentation. And I want you to identify these different elements in the recording. But how can we express ourselves when we are doing an appointment on the phone? I mean, we are receiving as nurses the appointment from a patient. So as we were checking, we need to greet the person and identify ourselves. Okay, so here we have some suggestions. Okay, common greetings like hello, good morning, afternoon, evening, your name. Okay, or you can combine them. Okay, here we have another option. This is and your name on the line. Hi, your name. And here, your name. Okay, how can I help you? Remember that this is a very common and formal way to offer your help. Remember that we were also checking this in previous units on how to offer help. Then we have this, hello, your name, and the name of your company. In this case, it's not your company. It is the hospital, the area, whatever. This is very formal way to do it. Now, what about setting a day and a time? Okay, so here we have different expressions. It is a combination between questions and suggestions. Okay, how about the day and the time? The day and the time work for you? I mean, good. Doctor's name available on, and then the time range. I propose you this time and this day. Does it fit your schedule? It is important always to ask the patient if it is okay for him or her to have this information, I mean this date. Otherwise, it will be not a recommendation or a suggestion, it will be mandatory. So be careful with this. Don't forget that you need to be empathic and polite with your patients. Okay, I suggest, for example, I recommend, I like to confirm our meeting. This is important when you are confirming at the end, almost at the end of the call, or in case you are doing a second call to verify if the patient is attending the appointment. I just want to confirm the details. Okay, this is again a follow-up of the appointment. Could you please reconfirm the day and time for our appointment on day and time? Okay, so these are some expressions that you can use to recommend or suggest the day and the time. And again, I want you to check these two tracks in which you will observe these elements, okay? Remember that I don't play the recording here because sometimes the sound is not the best, but you have the recordings within the presentation. I highly recommend you to do this so you can identify any of these questions or any of these expressions for greeting and identifying yourselves. So after checking the recordings, will you be ready to practice?